I have Kevin Dedner and Jeff Johnson. Kevin is the CEO of Henry Health, and Jeff Johnson is the Chief Cultural Officer. It is their mission to increase the life expectancy of Black men by 10 years over the next 25 years. Gentlemen, welcome to the Start Health Studio.
Thank you. Thank you for having us.
Startup Health Festival is so glad to have you.
Great to be here.
So tell me why this was an urgent message for you.
Well, 5 years ago I experienced a period of depression myself. And I saw 3 therapists before I could find a therapist who really understood me. And after I did, I started to learn as I talked more publicly about my depression that so many other men had suffered from depression too. And I have a public health background, and I was able to make the connection between the low life expectancy of Black men and unmanaged stress and untreated mental health issues.
But there's such a stigma with men and mental health, but particularly in Black culture about mental health.
Well, and it's been changing. And so younger generations talk about it with a level of freedom that our parents and grandparents never did.
Wow.
And there are books that are being written and athletes that are talking about it. And there's a level of transparency about it that creates an opportunity for us to talk differently. But I think more than that, people want to thrive. They don't just want to survive. And so if we're able to, in a real way, create a platform that speaks to a vehicle to them having power by operating in joy, then it's not just about therapy now. It's about how do I remove all the barriers to having the kind of life I know I deserve to have.
So if I am a Black male, which I'm probably the palest white person in the world, but if I'm a Black male, how do I access Henry Health? How do I get the services?
Well, right now we're providing services in DC, Maryland, and Virginia. And people can visit our website at henry-health.com. But our first version of our app is actually in the App Store, and we're awaiting approval. But we started providing services on a third-party platform this past spring.
So walk me through what it would feel like.
Absolutely.
So there's 2 ways to look at it, right? Ultimately, our goal is to provide teletherapy. And so you have the ability to go onto the platform, you're introduced to an option of therapists, you have the ability to go through the process of selecting a therapist, and then you're able to begin that process. But there's also this wraparound, because we understand that sometimes you need a bridge to get to that therapy. So meditations, daily affirmations, engagement to resources and information. But the beauty is that the content is so culturally specific that you see yourself in it. And I think that's been the problem. The clinical ecosystem doesn't tailor to some of those cultural issues that Black men specifically are dealing with, and so I don't feel like it's for me. So it's as much as it's the process of engagement and actually receiving therapy, it's also about, do I feel like this was made for me, or do I feel like it was made for somebody else? And that's why Henry Health is so important, because we're super serving African American men.
And I think one of the things that I also would pull out of that is what we're talking about is building community. Community around showing up whole, living with joy, and operating in power.
So explain to me how you're going to grow it. How is this going to expand?
Well, so we'll always be available in the Apple Store or as an Android product, but we're selling directly to employers, large employers, as well as universities. So we want to see this like as an offering in insurance through your payer or through your employer.
So is there going to be a Henrietta Health?
Well, you know what's interesting? When you think about the fact that African American men have the lowest life expectancy, imagine a world when Black men are whole. And so Henrietta benefits when Henry is whole. And so if we can super serve men, then whether they are married or fathers or members of communities, when Black men show up healthier, not only is there an impact to the broader Black community, but there's greater impact impact to where we're working, job satisfaction and productivity. And so we really are trying to really create this space where not only do we increase life expectancy, but how do we increase the vibrancy of communities by increasing the potential of Black men through mental health.
And how early is this going to start? When could I start using your app?
Well, again, people.
If all my freckles ran together and I became male.
So again, we are providing services already, but we actually have a call for partners out right now in the DC, Maryland, and Virginia site, and we're looking for sites to start testing our app as early as March, and we'll test it over the spring months, and we're planning a full launch at the top of the summer.
For 18 and above, 21 and above, what's the age?
So, it's interesting you would ask that because we are actually serving an adolescence right now.
Beautiful.
And so it's
beautiful.
It's not just about Black men. We're also going to be providing couples therapy as well. So, it's really for Black men and the entire community.
I'm so excited to follow your success.
Thank you.
This is so needed. You are answering a call. And the world thanks you for that. And Startup Health thanks you. It's such an honor. I'm going to say, I was there. I interviewed you right at the beginning. Really nice meeting you.
Thank you. Such a pleasure.
Thank you.
And thank you.
See you at the festival.
See you.